Hi there, my name is Vic V. I'm an ENT surgeon working for the NHS, and it's hay fever season again. So, if you have a blocked, runny nose with itchy eyes and sneezing, then these are some tips that will help you get through the season. So, one of the first things you can do is try and limit your exposure to these allergens. So, some people say close all the doors and windows, and when you come in from the outside, change all your clothes, have a shower, although that can be quite difficult and not really applicable when you're trying to get to work and back. So, what I think you can do is when you come in from the outside, is to clean your face with cold water to try and clear off the allergens from your face and maybe around your eyes, but also to clean out your nose as well. So if you use salt water like this Sterimar spray, and what you're doing is flushing out the allergens from inside your nose. So they're not continuing to aggravate your nose and cause an allergic reaction. Now, officially, you can use these sprays as often as you like, but there is an awful lot of salt content in there. So just be a little bit careful and drink plenty of water. And drinking plenty of water will also make the mucus in your nose slightly more watery rather than clogging up your nose and becoming more and more obstructed because of it. There are a number of steroid nasal sprays which you can get. This one is fluticasone propionate, otherwise known as Pyrenees, which can be purchased over the counter. But you can also have Demister, which has got some antihistamine in it. You've also got Flixinase and Nasonex. Avamis is also one which I don't particularly like. But there are some out there which are really, really good. And the reason why these particular drugs are really good is because when they're sprayed up into your nose, they sort of stay there. They don't get past your nose and spread through the rest of your body. Things like Beckinase and the other ones like that go through your whole body and you get steroid effect through your whole body. These ones, which are called low bioavailability nasal sprays, just stay in your nose and don't give you all the side effects of steroids as well. Now, the way you use these steroid sprays is to take the cap off, obviously, and spray towards the ear or towards the turbinates, basically, inside your nose. The turbinates are the areas which swell up and block your nose. So you're pointing this way and then you spray to the other side and you press down that way. And the idea is that you spray towards those turbinates and do not sniff in afterwards. Don't go like this, because all you're doing is sniffing all that stuff back into your airway and you swallow it, it's all gone. It doesn't really work anymore. Try and leave it in your nose for as long as possible so it works and doesn't get flushed away and then it doesn't work anymore. And just to remind you, before you use a steroid spray, use the saltwater spray to clean out the mucus and the allergens as well, because you want the steroid spray to touch the actual lining of your nose, not on the mucus. Spray up the salt water, blow your nose or sniff it up, whatever you want to do, clean it out. So when the steroid spray goes up, it actually touches the lining of your nose, and leave it there for as long as possible without sniffing that up. The last thing I want to say about steroid nasal sprays, you should start early with them before your hay fever season. So if you know every year that you have problems in May, start using them in March, April, and it gives you about 6 weeks for them to build up in your nose before you actually get to the hay fever season. And then it actually works. Trying to play catch up with these things afterwards is not easy because it typically takes a few weeks for it to actually start working. But once you've got it on board and it's at a clinically effective dose in your nose, because it's a little dose every day that compounds every day and fills up your nose and treats it before your season starts, that's much more effective and nicer for you as well. And when you know that, say in July, everything gets better again, you can start weaning it off and just seeing how you get on that way. Now, some people advocate the use of antihistamines. I don't really like it because it doesn't deal with the main problem with hay fever, which I think is a blocked nose. Antihistamines are really good with itchy eyes and sort of itchy throat when you sort of doing that sort of motion with the back of your tongue, trying to scratch the back of your throat. It doesn't really help with the nasal symptoms so much. The other problem I have with antihistamines is that they cause drowsiness. I think in the old days, everyone knew that Piriton caused a lot of drowsiness to the point where kids would just fall asleep in the middle of the day. Newer antihistamines say that they're non-drowsy. That's not true. They just cause less drowsiness than the old antihistamines. Now, obviously, some people have real problems with hay fever. And if you're in that situation that using steroid sprays, using salt water, and other things like that aren't helping you and you're really struggling, and if we can work out exactly what you're allergic to, then what you can do is something called desensitization. So, say in September or whenever you have the low season, there is an injection or a little tab that goes under your tongue that you use every day for maybe 2 or 3 years. And every year, your body is sort of acclimatized to these allergens, and therefore you're sort of become no longer sensitive to them, and you don't get a reaction every summertime. So, if you're in that situation, you're really struggling with grass or some of the other allergens out there, you can get an effective cure for these to try and get rid of these symptoms for good. You don't need to keep using the sprays forever. So see an allergy clinic or someone who's interested in hay fever symptoms, and hopefully we can get you sorted out. Do take care. Thank you for watching this video. Bye-bye.